panel for coming tonight to address this important issue. I have a couple of things that we say at every presentation here, and one is that there is, of course, always a chance that there will be an emergency during the presentation. So you can see that there are exits on both sides of the stage, and also the exit that you came in. So when you get out, please do. Also, there's a restroom that's essentially, two of them that are essentially right around the corner here. So you go out, take a hard right, and another hard right, and you can find the restroom and a drinking fountain out there. So we thank you again for coming. There are some people that I would like to introduce you to before I turn the floor over to Pat Fahy. And the first of them is Karen Carpenter here. Okay, I want to introduce you to Karen because she's not here yet, but she's hoping to show up. She is a board member of the Guilderland Public Library and also the former commissioner of the New York State Office of Alcohol and Substance Abuse Services. So Karen Carpenter-Colombo, you elected to our board back in May. We thank you for doing that. I think she'll be here a little bit later. Also, I noticed many familiar faces in the audience, but one important face for this issue in particular, sorry to do this to you, Mike, is Mike Laster, the principal of Farnsworth Middle School. Mike, if you'd give him a wave. Mike, I think you're also, like me, new in your role, correct, within the last year, so I wanted to introduce you there. I also want to introduce you to 3 librarians that are on our staff. I'll name them in a minute. We have 3 librarians who are certified by the Medical Librarians Association as consumer health librarians. And I'm going to tell you what they do and then introduce you. Among other things, they are available for consultation, private consultation, on any health-related issue to help you find information about that health-related issue, certainly including the issues we're discussing tonight. So those 3 librarians are Ann Wemble-Person, Sandy Tabor, and Maria Buell. And I just wanted you to be able to put faces to names, and you can stop into the reference desk or call and make appointments with them. A word of just caution on medical information. They are very, very good at finding it, but it's always important to point out that once you get that medical information from them, it's good to discuss it with doctors, not just with skilled librarians. So they're here, and we're happy that they're here. We also have, I just want to ask for a show of hands, how many people read the article by Paul Grandal on the Flood family in Sunday's TU? Okay. We are very, very happy that Mr. Flood, Kevin Flood, chose to be with us tonight. So Kevin, thank you for coming. And also, the author of the article, Paul Grandal, is here as well. So Paul, thank you for coming. And with that, I'm going to turn it over to you, Pat.
Thank you. And thanks, Tim, for hosting us here tonight. And thanks for reaching out. It was at Tim's overture that we decided to do this, and very much appreciated. And thanks to each of you, each of the panelists who readily agreed, in fact jumped at the chance, and there's a number of people here in the audience who also could have been on this panel. Very, very appreciative of that, and just the fact that each of you are here shows me how much you care, and often that is the first step. The rise of heroin and related drug abuse is nothing short of alarming, obviously. We've seen the reports, we've seen the problems. It seems to know no bounds. No community or even neighborhood seems immune, and Guilderland, as we know, is no exception. This forum has turned out to be timely. We did not know that Times Union was going to be running that series, and Paul, some of the most powerful articles that I've seen have been the recent ones that you've published, and we really do thank the Flood family, Mr. Flood, for being here. These have been heart-wrenching articles, and so many of the stories. None of these tragedies are limited to this series. It seems like every day there's a new story or more deaths that appear. Just today we read of the death of a Albany student, very sad, from alcohol abuse and excessive alcohol abuse. And in that article, I'll read the most recent stat, and that is that every year there's 2,000 college students nationally between the ages of 18 and 24 who die from alcohol, just alcohol-related unintentional injuries, or injuries, I guess. These are the students who made it to college. These are the ones that we think we've launched to success. So that's just one segment of this. And then I'll be honest again, I hesitated to do this when we first discussed it, and I know my colleague John McDonald has held a couple of forums. I hesitated partly because of my frustration of not having enough answers. But then I realized we all share that frustration. There are not enough answers. All of us are shocked at what is going on. And I recognize that there is value. There's value in continuing to raise awareness. There's value in educating, continuing to educate ourselves. And there's value in recognizing that there are some remedies there, that this is a problem, that we need to gather as many resources and approach through as many avenues as possible. One of the most important ones, of course, is prevention. And prevention is always the key to so many diseases, but it can also be one of the hardest. So self-reflection, I know, is a big part of this, and ways to be more aware, ways to be more involved, and ways to be more proactive, especially with our children. And I am particularly pleased that we have the Guilderland High School principal and the middle school principal here as well, along with, I know, many parents. So the more we can be involved, the better. We know we have to stop this. The panelists I'm about to introduce each have steps that they have taken to address, combat, and help eradicate the issue. Please keep in mind that they've also brought a number of handouts for you and your family. And with that, I just want to briefly mention each of the panelists so that we don't have to go through a long introduction, because we've asked everybody to be as succinct as possible in hopes that we can take questions, comments, concerns, and have enough time for discussion. So in the order that I think we're presenting, we're going to start with Sheriff Apple, who has just been a terrific resource for me personally, especially when I first ran into this with a family I know on some drug-related issues. And you were the first one to tell me about the, I think you used exponential increase in drug abuse in the last few years. So Sheriff Apple, really thrilled you're here. You will hear from him, I think, first on the panel. He has been working with all the departments throughout the county to try to address this issue. Next, we'll hear from our local police chief, Carol Lawlor, who I know has also dealt with these and been very aggressive in trying to deal with a number of these issues. And I know you're going to co-present, police chief will co-present with Doynow, who is also an emergency physician and on the Guilderland Police Department, works with the Guilderland Police Department as part of the emergency response teams. Next, we'll have Keith Stack, who many may know. He's the executive director of the Addictions Cares Center in Albany. It seems to be growing and growing, the Addictions Care Center, and they really are considered one of the more prominent agencies trying to deal with these issues, and not just the treatment part of this, but very much with the prevention as well, particularly focused on K2 and on family therapy, and again, you'll hear more. And then, as I mentioned, we'll have Tom Lutsic again from Guilderland High School, and then certainly, last but certainly not least, Lisa Wickens, who is not just a nurse and vice president at Whiteman Osterman for Government Solutions, but probably more importantly, she is a parent who has confronted this issue with the addictions of her child. So on a very personal level, and maybe we should have had you first, I'm not sure, but I think that will serve to wrap things up. And with that, I'm going to start with Sheriff Apple, and then we'll move to the others. And if possible, I think we're going to try to get through the presentations unless there's a very pressing question or something that's confusing, please, raise your hand. But otherwise, we'll try to get through the panel to leave as much time as possible.
One thing I forgot, Pat, was that
Sure.
we are taping, and I believe it'll be available on our website, and we'll also make some DVD copies that will circulate through the library.
Okay. And again, thank you to the library. This is a terrific turnout. And again, I know that just being here tells us how much you care. And I think it is that collective concern that will help us in facing these tremendous challenges. So thank you again to everybody. And with that, we'll start with Sheriff Ackle. Thank you again for being here.
Good evening, everyone. And first of all, thanks for the invitation. And thanks for taking time out. Before we get going with the taping, I know that we've done a lot of these forums throughout the county, and some people had issues with the taping. Is there anybody in here that does have an issue with that at all, or is everybody okay with that? I know there's a lot of families in here, and there may be even some people that that have an addiction themselves. So I didn't know. Just checking with everybody first. All right. So thank you. Yes, I'm Craig Apple, Sheriff. I got to I'm going to speed through this real quick. If you've got some questions, you can talk to me at the end, or pull me aside, or when the panel starts opening up. I'm a bit of a walker and a talker, so I'm going to kind of stand clear from that. But our primary duty in the county is we run the county jail, and on any given day, lately we've had anywhere between 850 to 880 inmates. It swings 30, 40, 50 a day, depending on releases, new arrivals, commitments, whatever the case may be. Of that 800 and some, you can take roughly 20 to 25%. The number slowly increasing. Was around 18, now it's up to about 20 to 25, hovers 22, 23, whatever. Directly related to pretty much addictions, to drugs, hardcore drugs. So that leaves 75% roughly. If you start to balance out that number, you can probably take 60 to 70% of that number and indirectly related to drugs. What's that? That's people that did not get popped for heroin or crack or coke or something to that effect, but it's people that are out stealing to feed their habit. Because what happens typically is I use a student as an example who gets maybe a basketball injury, torn rotator cuff, whatever. Doctor prescribes them 35, 50 hydros, Percocet, whatever the case may be, Oxy. They get addicted to it. Hey, that's pretty good. 25, 30% of first-time users are immediately addicted. So start to do the math. So they pop some pills. They're like, wow, that wasn't bad. Mom leaves for work. They go to check her medicine cabinet. There's a few in there, variety. They make a little cocktail. They keep it going. Wow, what am I going to do now? So now I start to hit my neighbor's house when they leave for work. Eventually you get pinched and you get hit. You come to the county jail for a short stay. I am not a treatment facility. We are a correctional facility. So what happens? You do a short stint. You get turned out with a bus token. See you later. So with that said, now we still haven't cured the disease. We haven't done anything for that person's addiction. So they get out on the street. Usually they hit quick. And I'm sorry if I'm blocking you. They hit quick and they'll either get arrested again and sent back in and stays a little bit longer. So the whole cycle just continues and continues, and the recidivism keeps driving up and up and up. And what the recidivism rate is how many people come back. All right? And in Albany County, the number's pretty high, and we've instituted a lot of programs to try to decrease that number. But with heroin as prevalent, and unfortunately as popular as it is right now, that number is still driving up no matter what we do with programs and education and prevention and treatment. We've got to try to kill that number and lower that number, and it's a daunting task to do it. So that's the jail portion of things, and again, I apologize, I'm going to kind of fly through this quick because there's so many other speakers, and I'm sure there's a lot of questions. But with that, so the problem is that we see people coming and going constantly. That's the bottom line. People that, some officers say, my gosh, that guy's doing life on the installment plan because it's 6 in, it's 6 out, it's 8 in, it's 4 out, whatever the case may be, but it's the same people. I've been out of the jail now for 26, 27 years, and when I still walk in there, I still have some of the guys go, hey, CO, how you doing? Back in the 80s when I worked in there. So there's times where we've had fathers, grandfathers, sons, you name it, in there. So what do we got to do? We got to try to break that cycle somehow. But if you don't go out and start to push that education, push that prevention, and push that treatment, not just enforcement, they're going to keep coming back. So, somewhere along the line, I was always a pretty aggressive police officer. Get the numbers, get the arrest. We got to get the arrest. You got to lock them up, get them up, lock them up, fill the jail, do whatever you can do. But somewhere along the line, I guess the light switch kind of came on and went, we're really not winning this battle. The infamous war on drugs. We've lost that war. And this is a whole new battle at a whole new level. And hopefully, I pray to God we can win this someday, but right now we are not. And it's pretty evident with the amount of overdoses, the amount of people passing away as a result of this, because they're making cocktails that are just way too potent to be taking in a human body. And it's sad, it's addictive, it is a disease, I believe in that. And listen, we don't need addicts in jail. It's not going to solve the problem. And the problem is that we've got a jail in Albany County that has a capacity of 1,049 for a county of 304,000 residents. I mean, that's a pretty large facility for somewhat of a mid-sized county. And to have a staggering number of roughly 80% capacity, 88% capacity at any given day is pretty high as well. So we've got to try to get out. We've got to try to keep pushing that education and pushing that prevention. We don't need them in jail. And the problem is there's nowhere out there for these people to go. There's nowhere out there. I will not forget one of the forums that I attended with Mr. Stack, where he told me it took 4 years to get the approval to build 16 beds. 16 beds to put that's 16 addicts. That's nothing, folks. That is nothing in the big scheme of things. I know most of the people present tonight are probably from Guilderland, I'm assuming, but this is not an inner city issue. This is not a suburban issue or a rural issue. This is a global issue. And the county sheriff's not going to be able to solve the problem. The chief of police is not going to be able to solve the problem. The state legislature, I think, can help us, kind of mediate some of the problem. But ultimately, this is going to have to come from the feds down and pushing down. And we need to loosen up some of these insurance loopholes. Let these people get in and get treatment. You're going to hear some stories where people say, he's not quite addicted enough. He's not bad enough yet. That's sad. That's really sad in this world that we live in today, to have to hear that. So I don't want to continue. I mean, I can go on for 3 hours. I can keep you here all night and go on a marathon about horrific stories that have happened and things that we need to change to make this better. And if anybody wants to talk to me privately or ask questions at the end, I'm more than happy to entertain them. But folks, when I came out about 1.5 years ago and I said, this is an epidemic, and everybody went, that guy's causing chaos and mayhem for no reason. Well, look where we're at today. And I've got investigators that are out every single day. And we don't want the low-hanging fruit. I don't want the addict on the corner trying to sell, 2 bags of heroin, to get money to, continue feeding his own habit and everything else. I want that mid-level, that high-level dealer, that big fish, so to speak, that I've been quoted saying. We've hit a couple of them, but unfortunately, again, the enforcement's kind of the easy part. It's what do we do with the one we have? Seattle started a program called LEAD program. It's called the Law Enforcement Assisted Diversion. And what they did is they trained cops in certain precincts, heavy drug-addicted areas that they always deal with, to go down and snatch these people up. You got them on a crime, so we're going to give you an option right now. Look, if they're a persistent habitual offender, maybe they should just go right to the jail. But if not, and they're a first-time offender or maybe a second-time low-level offender, let's take them to a treatment facility and say, hey, here's your chance. We want to make this right. We're going to get you some treatment. You mess this up, guess where you're going to end up? So they're even doing, creative thinking outside the box, so to speak, ideas out there to try to, do something with all of these people that are addicted. And you know what? It doesn't discriminate. It doesn't care if you're black, white, yellow, pink. It doesn't care less. It doesn't care about your social economic status. I've had, rich families with people that have overdosed. I've had poverty-stricken families with people that have overdosed. I've had rural people, inner city people, suburban people. And unfortunately, somebody asked me yesterday, is the pendulum swinging? Are we winning? No. No, we're not. Not at all. Not even remotely close to winning this battle. We took a guy off the streets of Colony with 16,000 bags of heroin. 16,000 bags of heroin that he was replenishing once a week. Once a week he was sending $25,000 cash every other day down to Brooklyn. Do you not think the guy down in Brooklyn had somebody on a bus within a day or two? Get up there, get roots in that town, and get me my money coming back. The other day we hit somebody with 1,100 bags. That's a small hit, quite honestly. Think about that, 1,100 bags of heroin, and he's constantly refilling. We're tracking him up and down the thruway constantly. Could do it every day. The problem is, what do we do with them? How do we stop this? We're going to continue the enforcement. We're going to continue to work with authorities locally. We're going to continue to combat it in schools. But you really, I firmly believe we need to get into these schools education-wise at a young age and start letting them know the horrific effects of what's going on. We need to continue to find, places locally that have resources for treatment. And what does that take? It takes money. Where does that money come from? So we need to constantly, I've had a number of conversations with our assembly members. We need to look at that. But, the enforcement, I think we're going to continue to, keep, plugging away and keep working forward. But we need to focus on those other two areas. And it's important. And, I really hate to think, we haven't seen the worst of it yet because all the residual effects of all of the addictions and all the people that have overdosed, that are clinging to life, all of it, that's still to come yet. So, is it horrifying? Yeah, it's horrifying. My heart goes out for the families that are present tonight that have lost children. I've got 3 boys myself, and it breaks my heart knowing that, I've got one in college that I'm scared to death every day because all it takes is one lapse in judgment, one party down on Hamilton Street in Albany, and then I've got a senior that I got to sweat through yet. And, are they good kids? Yeah, I hope they're good kids. I think everybody thinks their kids are good kids, I mean, they're good kids, but it just takes one slip up, one mistake, one kid to come forward and go, hey, try this. And they're mixing these potent cocktails, fentanyl and everything else. I mean, it's horrifying right now. And, now, I'm not trying to scare you all. I mean, unfortunately, I know there's several people present that have lived through it. And my heart bleeds for you folks. But, guys, everybody needs to pay attention. There's a difference from being a parent and parenting. And parenting means to engage more. So, thank you.
As always, terrific. And the sheriff has been in numerous forums and again jumped to help participate in this, so thank you. And again, we'll try to save the time so that we can hear from you because there are so many people. Father Young just reminded me he's been at this for 56 years. He could have been a panel in and of himself. So we will save that time and hear from others. Together, our local police chief, Chief Carol Lawlor, and Dr. Don Doynow, sorry if I'm saying that wrong, our emergency physician, are going to present just to talk about this at a more local level here, along with some remedies that they've been working on.
Very nice to see everyone here tonight, the turnout, and I appreciate everyone coming. I agree with the sheriff on everything he said, especially that the fact that people are not yet realizing that it's out here, it's in the suburbs, it's most definitely here. We work very hard day in and day out with educational programs, with, like the sheriff said, you can make so many arrests, but you still have to do the educational part. We work very well with the Guilderland School District. One of the programs that we have here is with our Canine Rocky, who was introduced to the students at the high school last year. He had a warm welcome, and he's been back several times since then. They do drug sweeps in certain areas of the school that the school district gives us to check. Right, as of now, there has been no significant amount of drugs found. However, I think he's had a couple of hits that we then turn over to the school district. So we are in the schools with programs, and this canine program, I think it's a real success. What I'm focusing on tonight is the most heartbreaking part of this, and that's the overdoses. In the past year and a half, there's been 17 opiate overdoses in the town of Guilderland. 7 of them were fatal. In June of this year, we received money from the Attorney General's office to begin carrying Narcan. Every police officer carries Narcan now. Paramedics have always carried it. We just started carrying it in June. Hopefully, with the paramedics carrying it and the police carrying it, we can get to the scene quick enough to be of some help. That Narcan or naloxone reverses opiate overdoses. Dr. Doynow has one of the kits and has a model to show it to you on, just so everybody can get the idea of how easy it is to use. Every police officer does carry it, they've been trained in it, and you can see how easy it is to use.
So I'm Don Doynow, I'm the medical director for the town of Guilderland, but also for Albany County Sheriff's Department. I've worked with Sheriff Hackle Chief Lawlor, and they've been very supportive of getting Narcan through all our officers. Every officer in the Sheriff's Department now carries it, as well as every officer in Guilderland. Initially, it was piloted in Staten Island by NYPD as well as in Long Island, and it's saved numerous lives. It's very easy. Narcan basically reverses the effect of any opiate, essentially the antidote. There are a number of different kits. I believe some of the kits that you folks have, that you've been training folks who have relatives who have been using opiates, actually have needles. The kits that we've given to the police officers don't use needles. They actually use an atomizer. The Narcan is readily absorbed through the nose, through the mucosa, so there are no sharps involved. It's very easy, and they can easily keep the kits looking. Let me show you what it looks like and show you how easy it is to do. We kind of brought along this dummy head that we've shown the officers how to do it. But basically, each one of them carries a kit. The kit basically has gloves in it, because obviously we want everybody to be protected. It has a little card that essentially gives the signs of opiate overdose. They've been trained anyway, but they can essentially look at it for reference. And then it has a Narcan. And the Narcan itself comes in a preloaded syringe that you get out there. It would essentially look like this. They would end up taking caps off. This obviously is just a test dose. They twist it in. They pull the cap off here. This is the atomizer. The screws on the end. And essentially what they would end up doing is just putting it here, injecting half into one side, and injecting half in the other side. And that's it. And within a minute or two, the effects of the opiate are reversed. And it buys some time until the paramedics can arrive. And we give additional Narcan if they need to. They can put an IV and give it intravenously as well. And it does save lives. It saves tons of lives down in the city. And we suspect it will end up saving lives up here.
I think we just used it a few weeks ago, and when paramedics used it, it did save a life. And so it's working. Again, we're doing all we can to fight this. I think that everyone carrying these kits is helpful. Like I said, the quicker they get that in their system, the better the chances of survival. But I just want to make it clear, we're well aware of the problem with Guilderland. We're working on it, hopefully with educational programs in cooperation with the school district, and working with organizations like the Sheriff's Department and their drug enforcement. The Sheriff said, we're losing the war, but we're trying. Thank you.
Thank you again, Chief, and Dr. Doynow. Very helpful, and again, everything we do needs to be on a multi-pronged basis, or within a multi-pronged approach, and that's part of what you are hearing tonight, and I know we are just skimming the surface, but it is important to look at each of these avenues. And with that, to hear more about treatment and prevention, I'm going to turn to Keith Stack, again, the Executive Director for the Addictions Care Center in Albany. And please tell us a little more as well about the agency, and I forget the numbers you serve, and I know it seems to be growing, so thank you.
Thank you. It's a pleasure to be here, and forums like this are exactly what we need more of. We need parents, we need community members, we need community leaders aware of what's happening and aware of some of the solutions. And I think more importantly, aware of what we're not doing or we need to do more of. Because that really is the answer. And I think everyone who's spoken thus far has really said that. We're doing what we can, we need to do more. At the Addictions Care Center of Albany, we have a number of services. We do prevention education in Albany County. We're the approved certified provider of prevention education in the school districts in Albany. I don't say that as a bragging point. I say that we're the only prevention education provider in Albany County. We only can do so much with the resources we have. We'd like to be able to do more. We love partners to help us, and I think the field is wide open. But we need more prevention education, and as the sheriff had said, we need to start earlier. We do work throughout all of the Albany City School Districts. A number of we're in Cahoes, Waterloo, and Urbana on a daily basis. We do a lot of programming with some of the larger suburban schools. We did an event last Wednesday night at the Guilderland High School. So we do a lot. We try and we work directly in schools regularly, but I think it's the best thing we can do is get parents and the students and the adolescents together in the same room, so that all hearing the same thing, and kind of normalize the discussion around alcohol and drug use and abuse, so that people can talk about it more openly. And that's what comes out of a forum like this. So we do prevention education. We use evidence-based curriculum to get the message across. We also are a residential provider. So we have clients who live in our residences, who go to treatment all day, and we have a typical outpatient service that we make available. I just want to read some facts. I usually try to avoid reading from notes, but in the United States, we represent 5% of the world's population, yet we consume 80% of the prescription narcotics worldwide. That's a staggering figure. So we shouldn't wonder why there's a problem. After marijuana, the most common illegal drugs teens abuse are prescription medications. 20% of high school students say that they have taken prescription drugs not prescribed by their own doctor. This is from a national survey on drug use and health. 1 in 3 teens say there's nothing wrong with abusing prescription meds every once in a while. So those are the terms that they use. 29% of high school students do not believe that prescription narcotics are addictive. So obviously, we need to do more education. We need more awareness. Also from the survey, sources of prescription narcotics used for non-medical use by students 12 years and older. 56% of the individuals who use them for non-medical purposes obtain them for free from a relative or a friend. And I would suggest, and I think our law enforcement officials will concur, they're stealing the drugs. They're going into their own family's medicine cabinet, or when they go visit friends or relatives, they're looking in their medicine cabinet, and that's how they're acquiring the drugs. That's before they become addicted. Once they become addicted, they're buying, and as the sheriff said, they're committing crimes to feed their addiction. In New York State, this is a 2012 figure, 25.9% of all drug-related deaths were attributed to heroin. We've heard from law enforcement people tonight. What we've been reading recently in the newspaper and hearing on radio and television, easily backs up that figure. People are dying from opiate addiction, and we need to do something about it. So that we need more prevention education. We need to get to adolescents sooner. We need to get to parents and children and their children together. We can do more in the schools. The legislature and the governor approved legislation this June. Actually, it was a pretty sweeping package of bills. One of those bills will require the state education department to update the curriculum every 3 years. So we're talking about the latest drug. Not your brain on drugs anymore. There's synthetic drugs that are made from bath salts and potpourri that people go online and they get access to the ingredients to make these drugs. So we need to be talking about the current trends, the current fad drugs, and we need to be talking about those to our children. So that's an important change that should have a positive impact. Treatment is available for alcoholics and addicts, and treatment does work. But heroin is a real challenging addiction. The sheriff said, and it's true, 25% of the people who try heroin will become addicted. And the primary population age cohort right now that is making up this epidemic are young adults, 18 to 28 years old. that's the majority of our population at the Addictions Care Center of Albany. I think Father Young will say that he's seen a predominant trend in people seeking treatment, 18 to 28 years old, and they're addicted to either prescription narcotics or heroin. And that's where we're going right now. That's changed dramatically just in the last 5 years, certainly. Our demographic has changed completely. This is a nationwide problem. I was in Woodbridge, Virginia over the weekend. It's an affluent suburb, 28 miles outside of Washington, D.C. On Friday, they had a drug-related murder of a high school student. On Sunday, they had a drug-related attempted murder of a high school student. Over the weekend, the news stations were promoting a special that aired last night, and it was heroin epidemic destroying our suburbs. So, it's everywhere, and it's the same problem. People start with prescription drugs, they become addicted, they readily and quickly turn to illegal heroin because it's much cheaper and easier to acquire. But I talked a little bit about treatment, and treatment works, but we have family members here tonight who certainly know the struggle of getting somebody into treatment. It's a struggle that frustrates us, me as a treatment provider. Private insurance companies do not approve, number one, the right level of care the first time, and and what gets approved, very short periods of treatment. With heroin, it's a complex addiction, and long-term treatment is required, and it requires long-term residential treatment initially. Then you can step down to lower levels of care, but we can't start a heroin addict at the outpatient level and expect them to succeed. It's not going to work. And I think if you look behind the statistics and looked at a lot of the overdoses and deaths from overdose, you'll find that there are individuals who are in treatment or have been in treatment, but they've never received the right level of care, which is long-term residential care. So it's frustrating for you as community members, as parents, and it's frustrating for treatment providers. If we're fortunate enough to have somebody in our residential program and they're paid by private insurance, we literally have to beg to extend that stay. 5 more days, 10 more days. It's a real process, and it's a frustrating one. Again, and Assemblymember Fahy was a part of this legislative package. We should see some relief next year. State insurance laws were changed that should force insurance companies to approve the appropriate level of care the first time. And that appropriate level of care will be based upon clinical decisions, not financial decisions. The laws changed, I believe, April 1st, 2015, and not soon enough as far as we're all concerned, but we should see an improvement. And again, it's people should get the right level of care immediately. If you have other chronic diseases, diabetes, hypertension, you're not given the least amount of care to start with. They try to arrest the disease, control it, and then manage it for the rest of your life. That's addiction. Addiction is a chronic disease, and it's it's not one stay in treatment and then you're all better. I'm in recovery, and I'm in recovery every day, and that's true of everybody. I'm no different than any other person in recovery. We need to recognize that as a society and give people what they need. And what we need is more prevention education, more forums like this, and we've been doing a lot of them all throughout the Capital District, and we need to make treatment available, and we need to make it available at the right level of care. And then we can start getting our hands around this this epidemic. Thank you.
Thank you, very helpful, and I do hope that the legislation provide some remedies, some assistance last year, earlier this year, I should say. Otherwise, I know, I'm confident we'll be back at it, just because, as the sheriff said, we haven't turned the corner yet. Just a few years ago, just very recently, we're reading that we've kind of turned the corner on diabetes, another very prevalent disease. And that has taken lots of education, lots of awareness, and lots of funding to treat. And I look at that in the same way, because it is a chronic disease as well, the addiction. With that, we'll turn over to our Guilderland High School principal, Tom Lutsic, and look forward to hearing, again, prevention. I am pleased that everybody is talking about prevention, and we know that that is so critical. Thank you.
Thank you. Thank you very much and good evening. I'm glad to see such a great turnout. It shows a level of concern which is warranted because as others have spoken about, there's a problem. There's no doubt about it, and it needs to be addressed. So I appreciate the turnout tonight. Many of us don't have to look too far to find a connection somewhere where somebody has struggled with addiction and how it's impacted their lives and the lives of their family. It's in my family, it's wreaked havoc in my family. As the chief said earlier, we've lost several past graduates to overdoses. It's a connection that can be easily made, and that's somewhat of a sad thing to say. It shows the prevalence of it. And I know tonight is about heroin, but really at the school level, we do a lot with making good choices. Because once a student, once anybody really, but once a child decides that putting something into his or her body to feel better is acceptable, then we've started down a road which could be very problematic. Addiction is progressive. Alcohol, marijuana, prescription drugs, even cigarettes can be a gateway to other drugs. No one ever says, I want to grow up and use heroin, but it happens. In my years of working in schools and working with kids, and then I was also involved in Western New York United and Kids Escaping Drugs when I was younger and first started my career, I never ran into anybody that heroin was the first drug that they picked up. It generally starts somewhere else. So really reinforcing the facts, as people have said, and that progression that takes place is critical. Once we put those substances in too, it alters our physiology. And particularly in young people, that's true for all of us, but in young people, their minds are still forming. They're still developing those habits of thoughts and those actions that they're going to carry out, sometimes for the majority of their life. So it's extra critical at that age. Also, other people have mentioned it, that idea of, when I was growing up, they had these TV commercials that showed, quote, the junkie on the street, and that was like not in our neighborhood, not that kind of thing. And that kind of image really has to change because, as other people have said, it can touch anybody, anywhere, and it's important to remember that. That progression takes place. And with the low cost of heroin and the resources that kids have today, it's even more accessible. Students have more resources and mobility than ever before. Money, cars, social media provide that access. It's amazing what the cash that I see on some kids, and it's $100 to get this or $100 to get that. Many, by the time they're able to drive, can drive cars, and the contact that they have via texting or social media, they can make arrangements to do this, do that, or whatever in a flash. And it's often very hard for parents and school officials to monitor. And there are many reasons that people start using, and the problem, how it manifests, doesn't always reveal the underlying cause. So in other words, somebody may be physically addicted, but there's also probably some emotional, mental, or environmental problems that are underlying that, if not addressed, really aren't going to change the physical addiction either. Some children self-medicate because of mental health issues. Others see it as a coping mechanism. And some seeing it as having a good time or a way to fit in. And they also model other people's behavior. And you have to remember, adolescents are trying to figure out how to fit into this world. What's their place? What's their role? And they push boundaries quite often. And using substances can be a part of that. And you don't have to work in education long before discovering that certain behaviors could potentially indicate problems with substance abuse. Grades dropping, not just kind of struggling in one class, but an across-the-board dipping of grades. Not hanging around with the same social group, becoming withdrawn, or going to a different social group that doesn't seem to have the same values or outlook that the other social group that the child had been hanging around with has at this time. You'll notice behavior and attendance problems, and when we call home, parents will notice that there have been some behavior changes too. And sometimes they're the first ones to contact us also. There are different levels of services depending on the individual, but most of what we try to do is preventative. We try to address some of those underlying issues before they turn into a problem. We host parent and community information nights. Character education starts in our elementary schools. We promote tolerance and acceptance, and we try to build community through such programs as the National Coalition Building Institute. And that's a group of kids that we do train-the-trainer workshops that train our kids to work with other kids at the middle school and at the high school. And that promotes tolerance, acceptance, good decision-making. And we have mix-it-up days, again, to build community. We have programs like Best Buddies, where general education students work with students with special needs. We promote making healthy and positive decisions through clubs like SAD that put on a lot of events, but they put on a victim panel each year that is really heart-wrenching. And registers, I know registers with a certain percentage of our population. Addiction and drugs are covered in health, science, and other curriculum throughout the high school career. We send 8th grade students and 10th grade students out to Choices 301. It's a program in Altamont that Ed Frank runs. I'm not sure how many community members are aware of it, but it's kind of it's a program that shows what drugs can do and bad decisions can do. He will also have people in recovery sharing their experiences with the students that are out there. And at the start of the year, we have assemblies, and we address each grade level at these assemblies. This year in particular, I talked about drug use and specifically heroin, but we also talked about making good choices and some of the things that we're talking about tonight also. We also set a culture where drug use is taken seriously. As the chief mentioned, we have canines that are in the school, and the kids are aware of that. We have partnership with law enforcement. We have a school resource officer from the Guilderland Police who is in our building. Discipline, if you use drugs or bring drugs to school, the discipline is severe. Doesn't mean we don't want to help you, but by the same extent, we don't want that unhealthy aspect of your behavior in our school either, and we need time to change that behavior. Our kids create public service announcements. They could be centered on bullying, drug use, and a number of things, and again, making good choices. We also work with support services. Our social work and counseling services work with parents as well as community agencies. Our staff is trained by our school resource officer in what the latest trend in drug use is, what the signs are to look for, and what some of the language that goes with it is, because people are pretty clever about how they can talk about certain things, and for most of us, we wouldn't even know what they were talking about, or what drugs can be in and contained, whether it's certain candies or even certain canisters that things are filled with. We had the National Alliance on Mental Illness work with some of our staff about that connection that can happen there also with drug use. And we transition, we often have students, not often, but we have students that are experiencing these difficult problems and problems of addiction. They may be at treatment centers, and we will work with the family and the medical facility to transition the student back into a normal school day. So that may mean a half a day to start, provide tutoring in the meantime until we can transition the student back in where it's a healthy environment. And we have an ACT or child study team that identifies some of those early warning signs that we talked about. And we pair groups of adults with those kids that we find are struggling. And we meet with them regularly and we talk about why the grades are low, why the attendance is bad. And we reach out to the parents and we try to put in supports that will raise those grades, improve the attendance in working with the parents and working with the group of adults with the child. And sometimes we discover those underlying issues And then we address those issues and reach for community help and, work with the parents in that too. But finally, it takes a whole community to address the problems that arise from addiction and the underlying causes that are causes of that. Acknowledging the problem and providing education are the key first steps in solving this problem. Thank you.
Thank you. That was so helpful. I'm going to need to bring you up to other education forums because I think replicating some of that in other schools is always helpful because, again, in the end, the only way to turn the tide here is through prevention. I just want to reiterate a couple of points because so many people know how much I feel about education, how critical that is to so many issues. But your point about the gateway drug, I can't state enough, and I was getting a number of emails from people as we were getting ready for this forum. And the gateway drug issue is important. And those gateway drugs, it's alcohol, and it is marijuana or pot. So there's no denying that, and I think that your point is really important. And the more that we can get children and students to make good choices to avoid any of these entry-level drugs is so important. That peer pressure, I'm also a huge believer in peer pressure, positive and negative, and the effects that negative or positive peer pressure can have. So arming kids with the strength not to just say no, but also those tools about how to say no. A terrific article just came across my desk today. And then thanks for the shout out to Choices 301. I visited that program in Altamont, and that program grew out of a tragedy, out of a personal tragedy, and I can't say enough about it. You've been incredibly patient. We have our last panelist, and then really want to open this up. Thank you again to Lisa Wickens, again our nurse, our advocate at Wakeman Osterman, but also more importantly a parent who has dealt with this, so thank you.
My actual name now is Lisa Wickens Altieri. I was just married a few days ago. The reason on the 25th of October. So one of the things the reason I'm here tonight was I actually did reach out because I am a parent of a child that went through Guilderland School, and we have faced this issue. I am a registered nurse. By background, I've worked as a registered nurse for 20-some years. When we started facing this, I had actually moved, I was a single mom at the time, and moved my children from Albany in 1996 to Guilderland School District because I thought it was one of the best school districts, and I wanted to get them out of the Albany School District before we got to Hackett, because that's a great bit. Being a mother and an RN and a single mother, my kids knew everything. They went to preschool knowing about HIV. They went to school understanding about peer pressure, about every drug you can imagine, and they knew about all this. Maybe a little overprotective, but my kids could tell you anything you wanted to know, probably in first grade, about a lot of different things. So, although I'm very receptive to everything I've heard tonight, I need to also say the reason I'm here is because I went to Guilderland schools. So saying that, I also, before this all started, I was actually the Deputy Director of the Office of Health Systems Management in New York State Department of Health. In that role, I was actually responsible for all state surveillance and regulations for all healthcare entities in New York State. So hospitals, nursing homes, home care, diagnostic and treatment centers. I worked very closely with OASIS at the time, it was Karen, in the Pataki administration. We worked with OMH. I was very familiar with all of this. I also had Patient Safety Center and all the other things that we hear that actually regulate the state, right, and Department of Health and all that health and human services that work together. So when in 2000 and probably 2003, I started at 16 noticing my son had come home actually drunk. And so the first thing I did was, I'm like, well, let's go, we're going to pediatrician. Go to pediatrician, say, okay, I have an issue, this is what we're facing, this is what we're looking at. You know, no changes in grades, no changes in attendance. My children actually went 3 years in high school without ever missing a day of school. And just noticed there was an issue. Pediatrician says to me, it's a phase, no big deal, I'll grow it. So yeah, I don't have that answer. So I went and found a counselor. I also went to Sparks and put my son into outpatient program. He was just turning 17. I had no other issues. I had no other symptoms. I had no other issues with going on at home. No changes in behavior. Things were well. Keep going forward. Senior year, noticed a couple other issues coming up. Smoked pot. Okay, he was still in outpatient treatment. 3 evenings a week he was going. Started to go to an AA meeting. Goes off, graduates high school with high honors. Right? Goes to New Falls within 2 weeks. He is in the psychiatric ward. Okay. And we have issues. And a lot of you have probably heard some of my story. I always try to mix it and change all the different pieces that I haven't shared before, because there's so many things that I just can't tell in a few minutes. Brought him back, asked to get him into inpatient program. Sorry, he hasn't failed. Well, he's been in outpatient program. I have done everything I think I'm supposed to be doing, and I need to do something. Now, mind you, I'm the deputy director of the Office of Health Systems Management. I know all these people. I know the CEOs. I know the commissioners. I know everything, and I still am struggling to get my kid in. Okay. Besides, let's go to Hudson Valley. Goes to Hudson Valley. Sitting in my office, left the Department of Health because I couldn't make enough money. I'm sorry, after 26 years of being a public servant, it was time. So sitting in my office, I get a phone call. Your son isn't breathing. He stopped breathing. What hospital would you like me to go to? Excuse me? He's not breathing. What do you mean he's not breathing? What's going on? No, we can't. What hospital do you want me to go? I'm going to go. Send him to St. Peter's. I'll meet you on my way. My son actually overdosed on a piece of a fentanyl patch that he'd stuck under his tongue. So as I stood at St. Peter's ER rubbing his sternum, because I didn't want them putting him on a ventilator, I actually went through his cell phone and called every single person that I had text and said, I have your phone number, I have saved your text. If you contact me, have to contact my son, again, I am taking the phone and I am bringing it down to the police station. If you come to my house, trust me, you won't want to ever come back. So we did all this, right? Get out of, ask for inpatient. Denied. Hasn't failed enough. Really? What's failure mean? Overdose? No. He has to go through outpatient for so long and fail, and then we can get it. Okay. I don't know. Then he decides we're starting on Suboxone, medication-assisted treatment. One of the things that we've talked about is that there's gateway drugs, there's pot, there's alcohol, there's all those things. All of those other drugs they climb an addiction like this, right? It goes like this. Opiates go like this. And the reason is it changes everything chemically in the brain. If you start before you're at the age of 25, you're not developed. So you have emotional, right? Emotionally, you think you're very grown up. At 19, 20, they're very grown up. But they have not actually worked on those skills that can say no, that can say risks versus benefits, that doesn't want something to happen right away. So until the age of 25, 26, their brain is still developing. And those pieces, those elements, so basically they're being set up to be it's the perfect storm. Emotionally, they're developed. But in the other areas of their brain, they're not. And then you get this drug where it actually changes the chemicals in your brain and increases the opiate, right? The dopamine effect. So the dopamine effect is what you get when you feel good every day. So the addiction goes up exponentially quicker. So it's not like some of these other drugs. So I have to make that point because literally it's a difference. You know, and Keith mentioned, and he's mentioned this when we've been on like probably 25 forums together, you know, heroin and opioid addiction is very different than other addictions. And it's very complicated. And it takes a lot of work. And it doesn't take a 5-day stay or a touch or an outpatient. You know, it takes a lot of work. And it all depends on where that individual is. That's what makes a difference. The other thing I want to mention is, and I'll tell you what else happened in his life, is that he graduated from Hudson Valley with a 4.0. Okay? He was smart. He wasn't changing. He's a musician. He's a composer. But he's off the charts on the left side of the brain, so to speak. So all those things that we've heard tonight, yes, they are things to look for. But it is not always the case. And I don't want any parent to sit there that's seen, that's heard any of this, to think, oh my gosh, I missed it. I mean, no. I'm telling you, it's different for everyone, and this is a different addiction. Okay, so going forward, couldn't get the inpatient, blah, blah, blah. My son actually started on Suboxone, which is a medication-assisted treatment, similar to methadone, but it's not methadone. Suboxone actually is a medication that helps replace so that their cravings aren't the way they are, right? So they're not craving that drug, but it actually has naloxone in it. So it actually limits the overdose potential. Doesn't mean you can't overdose on it if you mix it, doesn't mean a lot of those things, but it actually has a plateau effect. So it's a good drug, it's an option for some people, it's not the only one, and I'm just telling you, he tried it. It worked, it was working, it was doing really well. The doctor actually had come to Albany from Connecticut. The doctor's like, yeah, New York State really sucks. So I went back to Connecticut, because it was too difficult to deal with some of the issues. So we had another overdose. Tried to get inpatient. So at that point, you know, I pulled out a couple of stops, talked to some friends, got 5 days. 5 days. Okay, 5 days. When someone's going through an opiate withdrawal, they are so sick, they don't want to look at you, they don't want to talk to you. So doing inpatient for 5 days was a freaking joke. I'm like, you're wasting your money. You'll pay for it, fine, great, but it's a waste of money. Can I have that in like 15, 30 days and then have at least 5 days? No, you gotta come in now. Okay, fine, whatever. So, end of story. Wanted to try to see if I could get a longer term inpatient program. And my son was actually going through finals. He's like, yeah, no, I gotta finish my finals first. Okay, fine. Comes out, he's begging. And we basically, long story short, I took out extended my home equity loan, took him out of state. Then moved him down to North Carolina, did a lot of work. And so, you know, I read the story in the TU about the floods and reached out to the TU like within a minute of reading it to say, I need to talk to these people because I've been there. There's no one solution. People told me, kick him out, stop doing that. I didn't mention to you that he tried to commit suicide twice, that his stepbrother shot himself in the mouth because he was addicted and no one knew about it and he died. That, you know, I didn't tell you any of those parts of the story, but this is hell. There's nothing, it's nothing short of hell. And today, we have over 2 years sober. We have a young man that is married, confident, and actually, you know, played 2 Beatles songs at my wedding, which was absolutely marvelous. So there is hope, but there's a lot of work that still needs to be done. So in my position now, I've actually been a real complete nudge since I was in the Department of Health to a couple of my friends, Senator Hannan being one of them, who is the chair, the health chair in the Senate. and is from Long Island. And for like the last 6 years, I think I've harassed him while I've been driving to take my son out of state, saying, there's billboards out here, why don't we have billboards? You know, and saying, you know, and so we've gotten a lot done. This year, we actually got 12 pieces of legislation passed. The governor signed all 12. You've already heard that we will not have a denial. You know, basically there will be a review process, so an insurance company can't just say, no, you can't do that. I've been actually meeting with the insurance companies, and they're still doing it. But they have till April 2015, and there's a work group, and we're working on it. There's several components of trying to get more information out to young people and family members through OASAS. Senator Boyle actually did a piece of legislation that shows we want to get more education out there, public service announcements, but not just on television, because no one really watches television anymore. People watch, you know, Netflix. I don't even watch television. My mother does now that she's visiting. But, you know, really we don't watch television, but put it on Facebook, put it on Twitter, get it on the side of a bus, put it on a billboard. I saw one on I-90 today about someone's overdosing from alcohol, and for a prescription drug, call 911, don't run. Under the Good Samaritan law. I mean, like, great. Like, that's exactly what we need. So all those pieces of legislation passed in June. It was actually June 22nd, or June 21st. All 12 passed. We have a lot more work to do. There's a lot more to do. But we have, and like Craig had said, we've talked about this before. I'm sorry, Sheriff Apple. We've talked about this before. You know, we have a lot of young people right now, between the ages of 18 and probably 26, 28, that didn't die from an overdose, but lived with an anoxic brain injury because they didn't have enough oxygen. And they're in vegetative state. They're on ventilators. I have very close friends that, you know, they're in a nursing home. So we haven't seen the end of this. And we're not even at the peak yet. So what I believe is, as we've heard, we have to get education into the schools. I completely agree with that. My feeling is, you know, parents, you can talk to your kids, but really be honest with you, if they're like teenagers, they're not going to listen anyway. They're really not. But keep talking, keep trying, keep listening. I think that's really, really important. When you hear stories, you hear things like at this forum, throw them out there. Don't talk too much about it, because they'll shut down if you do. I also believe the reason we're starting to see some changes and we're getting legislation is we're getting parents involved. And we're hearing these stories. And I believe, in my heart of hearts, and I've never said this before, that we have to do this from a bottom up and a top down. When we looked at, when we started working on these forums with the Senate, I sat there and said it has to be a comprehensive package. Because when we did I-Stop, which was, you know, basically when you go in, it's like basically when you go in and the doctor tries to prescribe a drug, they can see if you're basically doctor shopping, right? It kind of stops that. What happened with that was there were less prescription drugs for the kids to get, so then we had the upsurge. So we had unintended consequence of a very good piece of legislation, which was an uptick in the heroin, because they need something, because they're physically and mentally addicted. So when we did this package this year, we really started to focus on a comprehensive model. So going forward, we got a lot more work to do. We're not done. But I believe it's got to be top down, bottom up, all sides. And we got a lot of work to do. And I do believe that I believe it's just don't stop. When people have asked me, what do you think worked? I say yes. Like, what do you mean? I went to programs. I went to Naranon. I have a library of books if anyone wants to borrow any, on anything, everything about addiction. I've talked to physicians. I've talked to physicians across the country for better models of care and better outcomes. I've worked with the Department of Health to try to see how we can improve some of the, you know, the care coordination. So the answer is just keep trying. Just keep trying. So thank you. I'm glad I was here to talk to you, and I appreciate your time.
advocacy. I know at the end of the session earlier this year, I said we cannot finish the session without having some means to address this epidemic. And yes, it was a package. Yes, there is no one solution. I think everybody has said that tonight. And I am also glad you mentioned iStop, because so many folks have said what was a well-intended initiative ended up with some very, very serious consequences. And when we got a grip on the prescription drugs, it fueled the market for heroin. We have a bit of time left, and thanks everybody for making sure we did have this time. I know there are a number of experts in the audience, and some of you who have dealt with this in a full-time capacity, in a professional capacity, and again, as a parent. I want to start with one person who is, I know has already been referenced, I think a couple of times tonight, even before you got here, actually. But the former commissioner of OASIS, Karen Carpenter-Palumbo, who is somebody who is also an Albany, sorry, a Guilderland resident, and now, well, still working on these issues, although former commissioner of OASIS. Karen, and I know you also mentioned you brought some materials. If you want to come up, or if you want to just speak from there, whatever insights, strategies. And then there's a whole host of other people, and we'll open this up as well. But Karen, I would really thank you for coming tonight.
Sure, absolutely.
Thank you for all you have done in this field.
Lisa said it all, and certainly I'm a trustee here at the library, so I'm glad you're here, because this library is about education. So having forums like this and being part of the solution is very, very important. But you all said it, and Pat, I'm so glad that you brought it together, because the one message I can leave you with, and I think Lisa said it, there are strength in numbers, right? What the research, I love the microphones again, too. What the research says, that the kids say, the #1 deterrent, and this is not to blame anybody, but still the #1 deterrent are they were on me. They were on me. My mother, my father, the teacher, the principal, the neighbor, the lady down the street. One of the reasons I was late tonight is I saw a couple of the kids in my neighborhood walking to Stuyvesant, Chipotle, and I say it wrong, they said they were going to Chipotle. They might have been, right? But what did I do? Because see, I'm a mom. Still have a teenager. Commissioner doesn't, just like Lisa, that doesn't protect our kids. We may have some more things that we know about and know more people. That doesn't protect from this addiction that skyrockets. So what do? I call the mother. Hey, your kids are walking to Chipotle. It's not Chipotle, but whatever it is. You know what I mean? That's what I call it. But your kids are walking. Are they supposed to be? Well, not Alicia. Really? Okay. So she's going to find Alicia. Now, I don't know if Alicia's doing heroin or smoking pot or smoking or drinking, but you know what? She could have been. And that's the message, if anything, that everybody has talked about. It is about prevention. Prevention does work, because you know who tells us? The kids. Because you're on them. I am not a cool mom. There's Chris Steffens is here. My kids will tell you, I am so not cool. But that's all right. That's all right. You have to be. You do be the one that calls the party. Is anybody there? You do follow them in the car, you know what I mean? Or where are they going, with the new license. You do check in on them again, and again. And even with that, that's not going to protect it. But it's one part, so don't miss that. And don't think the beer, just drinking the beer, because by the way, Craig, you'll tell them, heroin is cheaper than a 6-pack of beer. Right, so this is easier, quicker high, faster, so even drinking the beer, oh, it's cool, they only had 1 beer. Never. Right? Never. You did it. I did it. It is not now. So that's what, smoking pot the first time, 0 tolerance, absolutely. I am not the cool mom. You can't be the cool parent. You can't be the cool principal. You can't be the the cool legislator on it every single time. Prevention, that's what the kids will tell you. What is the #1 deterrent? And even if you can't, treatment works. It really does. It really, really does. Problems, legislation, everything we have to do, but we need to do it with law enforcement, because you know what? I was always a person that said, oh, people have to want recovery. Until I was in a drug court. And I knew, and the people told me, because I asked them, the only reason they went, and Father Young told me that too, the only reason they went is because there was a hammer over their head, jail or get treatment. So it works. I was a believer. you know? So that combination with law enforcement works, but I'll start with what I ended. Never, ever underestimate a community, the community, your role in the community. Never underestimate the strength you have in those numbers, because that's how you save lives. It really is. Thank you for doing all this today. It's very, very
Thank you. Karen and I met when our youngest were in preschool, and my kids are in the Albany schools. My daughter finished Hackett, by the way, a year and a half ago. Sorry. And is doing great, by the way, and now at Albany High. But I, too, am not a cool mom. In fact, I'm a very tough mom. But I thank you, Karen. Just
and I know we have some comments from our Oasis that are here with some information, right, Peg? Are you here? She's got a lot of good things. It is looking in your medicine cabinet, right, to see not just yours, your aunts, your grandmothers. It's very quick to go in there and get some pills, you know. It's looking all around. They've got some good information, you know. So
yeah, we asked everybody tonight to, you know, bring us. I always feel like I can't absorb this enough. I can't learn enough, and so do make note of, there's a lot out there, but I do think it's worth reading, educating ourselves, and doing all we can, because in the end, it is this openness, it is this frank dialogue that really does help. Again, had I not had those initial conversations, I think, with Sheriff Appel, what is going on? Is this, am I just noticing a couple of things, or is there a problem growing here? And he said, oh yeah. So I mentioned Father Peter Young earlier tonight. A number of other folks have mentioned him. We also have Mr. Flood, Kevin Flood here, that's also been referenced. Jessica Patnow, another friend and Albany school parent who does this professionally. Sorry, I'm going to pick on you. So I'm just doing a shout out to a few folks, or any hands, but comments, questions. We just ask that, because we're starting to run out of time, that people, whether it's questions, comments, concerns, that you be brief. But I've mentioned a few of them in case Father Young, Mr. Flood, Ms. Patnow, anybody wants to add to this, or if there's other hands. We usually don't have a bashful crowd here. Okay, we'll let those three off the hook for now. Thank you.
Hi, I'm Marcia Penrose. I run The Next Step. It's a long-term intensive residential program for women. And I want to tell you, I went to an addiction medicine weekend last weekend at Albany Med. One of the things they talked about was the fact that the DEA is changing its rules. We'll now be able to take medication back to our pharmacies instead of flushing them, God forbid, down the toilet, so we don't have to pollute the environment. Please, please, please go through your medicine cabinets. If you're not using medications that are in there, don't save them for something else. Take them back to your pharmacy. Get rid of them. I mean, they were talking about people who, if you have a house for sale, somebody is coming to look at your house, and an open house, people are going through your medicine cabinets while somebody else is keeping the salesperson involved doing something else. I mean, it's really incredible what people are doing. So please, please, please do that. The other thing that we talked a lot about was how a lot of doctors are not getting sufficient information about addiction. Doctors don't really like to treat addicts. And doctors sometimes overprescribe because they don't want their patients to either complain about being in pain, or they're just being very kind and don't want their patients to suffer. But too many people are getting too many prescriptions, and we need to be very careful when you take your kids to the doctor or the dentist, which is another issue. Please watch what they get. Talk to the dentist. Let them know what's going on, and make sure that they get as little as possible, not as much as possible.
Thank you. Thank you, Marcia. I didn't realize you were even here, and I visited the Next Step program, and a terrific program that is yet another vital resource in the community.
Thank you, Jenny. My name is Brian Barr, and I'm from Senior Hope Counseling, and I'm with my colleague Betty Devine, who's on the board of Senior Hope Counseling. And the reason I wanted to say a word is I knew the conversation would tilt, and rightfully so, toward our young people in the community, because, my gosh, they're the folks that we we think about and we have great concern about to lose these precious lives. But I would like to bring to your attention that Grandma, Grandpa, and Auntie, and our uncles, our senior population is very much at risk. The demographics show us that we're certainly having more and more of our seniors that are with us, and more of our seniors are moving into that risk population where isolation, loneliness, physical fragility, and moving away from the roots that they had experienced puts them very much in a vulnerable position. And it's so easy for them to turn to supports and dependency outside of relationships and work in familiar patterns that have been part of their life, that they are very vulnerable to addiction. And it may seem, as when I mentioned when I came in, I think I mentioned to you, Jenny, that seniors and heroin and coke and crack and things like that may seem a little alien, but when you think about, we work with senior hope counseling with folks 50 and over. When you do the math, I mean, think of it. Age 50, that's really not that old. And these drugs, either one could have experience with it, so the therapist needs to be familiar with it. And again, you can snort, you can ingest, you can do all kinds of ways of getting into your system. So it is, in fact, a threat, not just to our teens and our college-age kids, but even our seniors is a distinct threat. So it's something, please keep your eye on it. Your seniors, if you see them drifting off, if you see them getting too isolated, be attentive to it. Reach out to them. Let them know you care for them, and they're still very much a part of our community. Thanks, guys.
Thank you. Excellent point. Thank you for bringing that up. As I said, I think we could have had 20 people on this panel and a host of folks mentioned, but you didn't cover this and you didn't cover that. So thank you very much. Other questions, comments, and again, we have a whole panel up here, so I am the furthest thing from the expert. So if there's other questions, comments that you have for our panel. Oh, go ahead. Sorry. Yes, Peggy.
Hi, I'm Peggy Bonneau. I'm with the Office of Alcoholism and Substance Abuse Services. And I applaud you all for being here. I applaud Assemblymember Fahy for pulling this together, but I applaud you all for being here. We had the task from the governor to put together a campaign. And hopefully you saw some commercials this past September that was called Combat Heroin. We have materials in the back. We need to continue raising awareness. It was a short campaign. Buying advertising space from New York City, Long Island to Buffalo isn't cheap. So we had a campaign that ran for 4 to 5 weeks, and we look forward to doing more awareness and education. But one thing that we learned before we developed the campaign, we talked to parents, we talked to kids, we talked to students. We talked to young people in recovery. We talked to people that were clueless, that didn't have any idea about this issue. And we heard it starts at home. Denial is nothing that we can hide from anymore. Someone said it's not just a little pot, it's not just alcohol. It's a progression. It certainly starts there and it continues. But the other thing, as good a parent as we can be, it can happen to any family. And we heard that loud and clear. And I know that you're all interested, you're all here, you're good parents, but it can happen to any family at any time. So don't think that it can't, and do not think, oh, it's happening over there. Right now, Guilderland's getting a lot of attention. So the people over there are saying, it's happening there, it's not in my neighborhood. Guess what? It's happening in every community. And to think that a parent that is going through this, I've talked to parents who have lost children, I've talked to parents who have children in treatment. It's me, it's you, it can be any one of us. So I applaud the families that are here, and we'll continue to pray for you and raise awareness about this issue. Pick up some information, visit the new website called combatheroin.org. .ny.gov. There's free information there. Educate yourself, educate your children, educate your neighbors. Take some flyers, hang them at Brugger's, hang them at your church, hang them at your temple. Spread the word, because nobody can be in denial anymore. It's so important, and it can happen to anyone. So I'll end there.
Thank you, Peggy. And again, really appreciate the work on this.
My name is Mark Graham. I'm Guilderland resident, former town board member. I read that flood story and I was really heartbroken and horrified. But what struck me about it is they gave all that they had, $400,000 for treatment. Because we're hearing a lot about treatment tonight. They tried it. It didn't work. So are we sufficiently analyzing our treatment? What are the holes in our treatment? Because they're not a singular case. And I've known addicts in my lifetime who went to treatment and it didn't work out so well. And given that there's limited resources, what about changing the culture that Tom talks about? Would our investments be better in changing the culture? Why does a kid choose a substance in the first place? If we put more resources there, wouldn't that stop the problem? So I guess that's my question is, are there holes in treatment and how do we fix them? And how do you answer Mr. Flood?
Thanks. I think we've heard a little bit about that tonight, and I'm going to turn to Keith to see if you have anything. I know we're going to run out of time in a few minutes here.
Yeah,
See if you have anything to add.
I'll speak to that quickly. There are holes in treatment. I think the first hole is at the beginning. People don't start with the right level of care in the beginning. So you start burning up, as Lisa said, you start burning up resources, frankly, inappropriately. If people they begin with a more intense level of care, their likelihood of success increases dramatically. But when you think about addiction as a disease, for example, currently our system right now is it's not a chronic disease model. It's more of an acute treatment model. So you may get a month, you may get 45 visits if you're with your insurance. You may get 45 or 60 visits of outpatient care. But that's it. And I guess the belief is that after 45 days or 60 days, you're cured. And in fact, you're not. Addiction is a chronic disease, and there's no structured aftercare available for addicts right now. If you have hypertension, if you have diabetes, you can constantly go back to your doctor. If something's not working, they'll try something else. But that's not the case with addiction right now. So we have to develop. I think hopefully the insurance law changes will allow people to get the right level of care initially, but we also have to develop an aftercare model so that when somebody comes out of treatment, they're not just, you're cured. And, I went through 9 different treatments in my lifetime. And when I think about it now, I remember getting discharged. You get a coin, you successfully were discharged. But then I would get plopped back home. And I would just get plopped back home. Everyone in my life, if they wanted anything to do with me, that would be great. But the reality was, this whole world was racing around me, and I had no idea what I should be doing after that. We need to provide aftercare support for people, immediately upon their discharge from treatment, so that they're just not alone and at a loss for what to do.
Thank you. That's terrific. Aftercare is so essential. Okay, I know we got a couple of more questions, but go ahead. And,
one thing is that what Keith just said. There's also a piece of legislation, and OASS now through Medicaid actually pays for peers. So for someone that's actually gone through recovery, to work with someone side by side that's also going through recovery. So these are some of the different models. The problem, if I was to say it very quickly, is that in medicine, as a nurse, I can tell you that there's certain outcomes that we expect for a hypertension. We want 120 over 80, we want you to take these medications, blah, blah, blah. We haven't done that in mental health and addiction. So we're trying to start now to say, let's hold these things accountable. Let's look for what's a good benchmark and decrease the recidivism rate. So that's really what we're starting to work on now, and I think we just have to put more money into research, similar to what we've done with cancer and diabetes and everything else. So that's really some of the things we're pushing. We need to get more money in this area, so there you go.
Thank you. I know there were a few hands up and we're about out of time, so I want to get to those couple. If you can keep your comments or questions brief, and we'll, I know we said we'd end by 2:30. And
hi everybody. My name is Greg Spencer. I've worked in the field for 25 years as a clinician. I'm a recovering guy. I've got one question. And we're talking about getting people into treatment, getting the insurance companies to pay. And I asked this question several times before at the get-togethers. Where are the beds? They aren't there. Greg mentioned that. Lisa and I talked about that. She had to go out of state. You know, we can talk about the insurance companies getting people in. Where are the beds? We don't have them. We've got to get somebody to start putting more beds in here for these people to be able to go someplace for treatment. That's all I wanted to say. Thank you.
Bed 99 of them. That's empty.
Any other quick responses on that?
No, I think the sheriff was using ACCA as an example. We were approved for a 16-bed. We were approved for a 16-bed women's halfway house in 2007. Actually, just today we got the 30% design drawings from the architect, and the expectation is that we'll start construction in May. We'll be in the facility in December of 2015. So, you know, we're approved in 2007 for 16 beds, and in 2015 we'll occupy.
Okay, that's a sobering note in and of itself, but thank you for your perseverance in getting those beds and availability. Okay, I see one more at the back, and then we'll, and by the way, I know that a number of the panelists are here for at least a few minutes after the event, so if you have questions, comments, please feel free to come up afterwards, and we'll have a few minutes. Go ahead.
I have just a brief comment as a parent whose family has dealt with addiction. I wonder if there should be given more thought, because Mr. Stack and Lisa made reference to the mental health component of it, of dual diagnosis programs. I think that would go a long way rather, in combating perhaps recidivism, if both issues could be addressed.
Thank you. I will say the mental health issues in a whole host of fields, in the criminal justice field, and education, and mental health is just, talk about another epidemic. That's dual diagnosis is, I guess, a good approach to it. But that we could have 5 other forums just on the mental health crisis alone, and I'm sure, I don't know if there's any quick questions from our panelists on that. Education, I know it's a crisis in education with getting the resources to treat students. So our principal, Lisa, you have a quick comment?
New York State Department of Health with all the other agencies is actually working on what's called district, but it's basically redesigning to try to change the structure and outcomes. So it actually means that some of the St. Peter's and the larger systems that we're used to have to actually develop programs that focus on certain areas, and the areas have to, those projects have to include something in substance abuse and mental health. So the state's trying, that is actually, applications are due in December, so that's actually a 5-year plan to decrease the number of hospitalizations by 25% over 5 years. So there is some work that's starting in that area. We think it's going to take some time, but there is actually a focus on that area because those are the highest utilizers of the system. So that's where a lot of the focus is right now, which is actually a good thing. So.
Thank you again, Principal. Anything on that to add?
Yeah, I mean, I would just agree there is definitely a strong connection. As I mentioned earlier, you know, we had representatives from the National Alliance on Mental Illness come in and work with some of our faculty because of the connection there. We struggle getting beds, Four Winds, Ellis, and you know, you name it, it's very difficult to get young people some support for the mental illness, which is often accompanied with addiction, and that self-medication is a huge thing that we see with kids.
We estimate 80% of our clients that we treat right now have co-occurring disorders, and Karen really was a leader in recognizing that and started, I think everyone talking about integrating the levels of care, the two types of care, behavioral health, mental health, and addiction treatment, and treating both at once.
Thank you for raising that point. I think we would have been remiss had we not mentioned the mental health and the alarming, the connections, and then the problem in and of itself. I'm going to, yes, absolutely.
Going
Jessica
back to the addicts in Albany County, is the Narcan provided to addicts?
I can answer that. Catholic Charity, actually, people in this room can get trained, I'm sorry, people in this room can actually get certified and get trained in Narcan.
Is it offered to the groups of heroin addicts in the community?
So Catholic Charities keeps
they're at our facility, on a regular cycle, training our clients. We actually, at discharge, make sure our clients leave with a Narcan.
So where would they be referred to from outside agencies?
Catholic Charities over on right across from Bishop Begins, where there is Project Safe Point. Joe Philippione was here earlier today, dropped off some material. Doctor, you can speak to how people can get trained. But providers are beginning to see that that's available within the treatment setting. Family members, absolutely.
I'm actually certified, so I recommend that to everybody. It's actually not a bad thing. I carry it with me everywhere. I carry it with me when I travel. So it's very easy. You can use the nasal, the atomizer, or you can actually get the injection. So it's something, actually, I can give you contact information for Keith Brown and Catholic Charities.
It's free.
They'll do it.
The prescription's free.
Yeah.
Keith, doesn't the county do a monthly training as well?
I'm sure they do, yeah.
County department?
And they're using Catholic Charities.
Right. They're using them, but I believe it's at Albany County.
At the addiction treatment centers, we've been doing training, and there's also a listing on the Combat Heroin website of where you can get trained. I know there's a training on December 2nd at the Empire State Plaza. It's all free of charge, so go to the Combat Heroin website.
Yeah, I'm more asking about the addicts though, and they're not on the website, so just for people that come in contact with them, wherever it is, just as Catholic Charities.
Yeah, Catholic Charities does it. They have the needle exchange program, and they actually do training right there. And they do it all over.
Yeah, I carry, but when we got trained, it wasn't, I asked that same question at the training, and they weren't able to provide information of where an addict can actually go so that they're carrying it when they're with other addicts, because that's where they overdose.
Well, Catholic Charities actually has a mobile van that travels throughout the Capital District. They hand out clean needles, but they also do Narcan training, and they also talk to the individuals about treatment as an option. It's Project Safe Point.
That's the
Excellent
needle
question.
exchange program everywhere.
Yeah, excellent question, and we're happy to put out more information if helpful on a couple of these sites. And again, there's information at the back. Thank you for staying with us too. We ran a few minutes over. Thank you for your patience. I want to thank again the Guilderland Public Library, including Tim Wiles, for reaching out, for hosting this. All our panelists, I've learned a lot. I need to go home and really absorb a lot of this. I know we've also filmed this, so that will be available. And is that going to be available through the library website?
Yes.
Through the library website, through the Guilderland Public Library. And I want to thank Jenny Farrell in my office, along with Kathy Fahy, for helping with the countless logistics here. And again, just thank you for being here, because it says so much about that you care. And I really do believe in the collective action of folks. And it takes, as everybody has said, there is no one answer here, there's no one solution, there's no one way to address this. And so part of it does start with this education, and part of it does start with this collective action and attentiveness to this issue. So really appreciate the turnout, really appreciate the interest. It does always give you hope. You have to, in this business, you have to remain an optimist at all times. And it's nights like tonight that make me optimistic that we will tackle these issues. Thank you again to everybody.